What was quackery in historical medicine? Imagine a time when doctors had very little idea about how the body worked and treatments were often based on old ideas or guesswork. That's when quackery became a big part of European medicine. Quackery means selling fake or useless cures, often by people who had no real medical training. These so-called healers, called quacks, claimed they could cure everything from headaches to deadly diseases. The word quack comes from the Dutch word quacksalver, which means a seller of salves or ointments. It's been part of European history since at least the 1600s. Back then, medicine was based on the idea of humorism. This was the belief that health depended on balancing for bodily fluids: blood, yellow bile, black bile, and phlegm. Doctors thought that if these fluids got out of balance, you got sick. To fix this, they used methods like bloodletting, where they would cut veins or use leeches to drain blood. These treatments often did more harm than good, but they were the main ideas of the time. This created a perfect environment for quacks to sell their own remedies. One common type of quackery was patent medicines. These were special potions and pills sold across Europe, especially in Britain. They were packaged in colorful bottles and promised to cure all sorts of ailments. Many of these medicines contained alcohol or opium, which could temporarily ease pain or discomfort. But they did not actually cure anything. They were marketed aggressively, with claims that they could fix headaches, stomach issues, or even serious diseases, despite having no scientific proof. During major health crises like the plague or the influenza pandemic, quackery thrived. When doctors were overwhelmed or fled, desperate people turned to unproven remedies. During the Great Plague of London in 1665, many quacks sold cures that had no real effect. Similarly, during the flu pandemic of 1918, fake cures flooded the market, promising quick recovery but offering nothing real. Some of these treatments were bizarre, like tobacco enemas used to revive drowning victims or treat various illnesses. They believed inhaling tobacco smoke could warm the body or stimulate breathing, which was completely wrong but widely practiced at the time. Many quacks became wealthy by selling their fake medicines. They used fancy marketing, colorful packaging, and social events to gain trust. They often had no medical degrees but convinced many people they had special knowledge. These practices were especially common when real medicine was limited or ineffective. It was a time when science was still developing, and many ideas about health were based on superstition or false beliefs. In the end, quackery was a big part of European medical history. It was driven by ignorance, fear, and the lack of real cures. It shows how important scientific progress has been in making medicine safer and more effective. Today, we know that real healing comes from evidence-based science, but understanding this history helps us appreciate how far medicine has come.